panel, David Mercer, former deputy finance director for the DNC, and Angela McGlowan, a Fox News political analyst. Great to see both of you. These numbers are, Angela, a little bit more of what the administration hoped to see, but is it enough?
It's not enough. And Jamie, they're going to go out and have this big political communications campaign talking about the good news of Obamacare. But the facts are this: the Affordable Care Act, Jamie, is not affordable. It's costing more people more money. And when January 1st hits, we're going to have billions of dollars in tax hikes. So I think it's a rough road ahead. And the fact of the matter, too, is the majority of American people believe that either the law should be repealed or they do not approve of it.
You know, David, we've detailed on Fox News. We report folks decide some of those new taxes and costs. Doctors are concerned they can't tell patients what deductibles will be for surgeries or procedures scheduled after January 1. There's so much that we just don't know. When do you think Obama and the administration, the president and the administration, can put this all in a rearview mirror?
Well, I think they are beginning to put it in a rearview mirror with, as we heard at the outset of the program this afternoon, that 27,000 enrolled in October, and we're now at over 1 million. And that's not counting several of the state exchanges who have seen their enrollments up in New York, California, and elsewhere. So, you know, success breeds success. And as more people begin to share the experience of the 1 million plus that have enrolled, that their deductibles are down, that their premiums are lower, that their young adults, children are also on their health care. They're not being denied coverage for pre-existing conditions, that they're also getting rebates with reference to Angela's comment about taxes.
Some are getting subsidies. Some, like the president who applied for the bronze plan, wasn't eligible. And I'm glad you brought up the success stories. Go ahead, finish.
Jamie,
yes.
if I can say, there are rebates, not just subsidies. There are rebates because of the 80-20 rule in the Affordable Care Act that requires that insurers spend 80% of the premiums on health care related costs and not others like marketing and so forth.
It's different.
And that is providing rebates to
but David,
premium
not everybody's
holders.
eligible, and the people who are may not even know that they are. There's still a lot of confusion about the plan.
And that's why we're here to talk about it.
Well, you bring up the success stories.
But Jamie, I have to
Angela,
add this.
hang on.
Jamie,
I will,
please.
Angela. I'm going to let you add anything you want, but I want to just ask you this as well, if you don't mind. The success stories that David talks about are a prediction. We don't know yet what it's going to look like because it doesn't take effect till January 1. When it does, and Democrats come out with what they say are the success stories, how much will those stories play a role in, let's say, the midterms, which will be following right after?
Jamie, there will not be that many success stories.
How do we know?
And whenever you hear,
whenever
you hear rebates or subsidies, somebody has to pay for that. It's just not, we're just not going to pull those things out of the air. So you're not going to hear those success stories maybe for lower income people. You're not going to hear those success stories because Americans are going to have to pay more out of their pocket to help support this flawed legislation.
So you're saying those stories come at a price?
Those stories come at a price, and the bottom line is this. I'm from Mississippi, so when you take a pig and you dress it up and you take it to New York, it's a dressed-up pig, and that's what the Affordable Care Act is. And no matter how you try to dress it up, no matter how many glamorous stories you try to tell about it or make up stories, the bottom line is the Affordable Care Act is not affordable.
Okay,
Jamie, if I might speak, putting pigs aside, if I might speak to the market fundamentals here, and that is the whole principle behind Affordable Care Act is that with more insured, you have a larger pool of consumers and customers for insurance companies to overall reduce the costs in the delivery of health care and reducing health care costs.
Well, are we at that number yet, David? Because the White House is today bragging about numbers about the number of people that have enrolled. Are we at the number now where the other people don't have to worry that it's going to cost them?
I think we're on an upward trend. I don't think it's a matter of bragging. I think it's a matter of reporting what the facts are in terms of what the enrollment numbers are, and that we want that upward trajectory, just as the same happened with the rollout of Medicare Part D, which Speaker Boehner said was horrendous in its rollout, but now the extreme success of it, you don't hear anybody talking negatively about Medicare Part D, nor do you hear others talking negatively about Romney Care, although Romney himself might have distanced himself in seeking the nomination. So the success stories will amount to further success.
Okay, point made. Angela?
David, putting pigs aside and talking about the marketplace, what about the fact that for insurance companies, there's a user fee, a 3% tax, so that will be passed on to the consumer. Everybody that signs on to Obamacare, they have to pay a $2 fee. Even the Cato Institute, which is more of a moderate, I guess you could say, study policy group, said that each American might have to pay upwards to $6,000 in taxes. So if you want to talk about the marketplace, my point again is the Affordable Care Act, noble in purpose to make health care affordable, is not affordable. Let's not repeal it. Let's go back to the drawing board and fix it.
When Congress
a million people think differently.
Well,
so
a million is not all the people that are supposed to be covered. And then there's that 13 million that are here, illegal immigrants who don't have coverage at all that we'll still have to pay for. It just seems like there are a lot of questions and a few answers coming in, so we will stay on it.
We have 3 months for it to unfold and get increased enrollments to the numbers that we need.
Taking a look at what it looks like right now, I think we covered it. Thanks to both of you. Appreciate your time.
Thank you.
Okay, take care.
Thank you.